specialist here today that will give us more of this data as well. It has become more important for us to get the vaccination because unvaccinated individuals are where the COVID-19 is going to mutate. And these are the individuals that will give it to their loved ones or will be responsible for the community spread at this point. And when I talk about how many vaccines have been given, the point to make here is, a lot of people say that there's not enough data about vaccines, but when you look at how many vaccinations have been given from the start, where we started the research, it got approval to the FDA or EUA through FDA, to the point that we are here now, it's 2.45 billion people that have been vaccinated. When we talk about COVID-19 vaccines, they're, currently that we're dealing with in the U.S., majority are mRNA vaccines, that's Pfizer and Moderna, which is where the material from the COVID-19 virus is given through a vector, given into our muscle, and so that our cells can make antibodies against the spike protein, which there's a little slide about that too. The second one that we are dealing with now, and we have seen more and more, J&J, AstraZeneca, and Sputnik. In the US, we only have J&J. These are vector vaccines that have the adenovirus, which is a weakened virus, which is different from COVID-19, but it contains the genetic material or DNA from the COVID-19 virus, and that's how it presents the COVID-19 viral DNA to our cells. So our cells can recognize it and can make antibodies. So when we actually see that virus, we can actually contain it and not let it replicate in our body and can protect ourselves. And this is just one depiction of, when there's either the mRNA or the DNA of the virus, even if with the adenovirus vector in a liquid form, we inject that into the patient, and then it enters the cells of the individual recipient. Their body kind of metabolizes it and presents that protein to our immune system. So our immune system recognizes that protein and starts making antibodies. Those antibodies, once our immune system has that memory that, oh yeah, I have dealt with that protein before, once you get the real virus, you're going to have those antibodies in your body that will actually protect you from that virus by neutralizing that virus, so it does not attach itself to your cells, or even if it does, it's lower of an immune response. And remember, nothing in life is 100%. And that's another slide that we'll go over, will depict that you still see some breakthrough infections because, with the AstraZeneca and Moderna, the Moderna and the Pfizer, we have about 94% and 95% effectiveness. With J&J, we have about 66% effectiveness. So you will have some breakthrough cases, but it'll protect you about 94, 95% from getting the severe disease or getting the viral infection. Now, the data that I said about, you got 2.45 billion people that are vaccinated. And when you look at the side effects, everything is going to have side effects. Any one of us that has ever gotten a vaccination, fever is common. You can get soreness around the injection site, have muscle joint aches and headaches and tiredness. But it's nothing like getting the COVID virus itself, where you can end up on a ventilator, hospitalized, or even die from it. So when you compare the two, you have to see how many people have died from the virus, and then how many have side effects from the vaccine. And the statistics are appalling. It's just a no-brainer at this point to get vaccinated. This is a busy slide here, but just to kind of quickly give you an overview, you got Moderna, Pfizer, and you got J&J. Moderna and Pfizer, there are 2 doses. J&J is a single dose. The Moderna and Pfizer mRNA vaccines, and then the J&J is the adenovirus that vector that delivers the viral DNA so your body can make the antibodies against the virus. Effectiveness-wise, when we talk about the effectiveness, any vaccine is better than no vaccine at all, and all of them will protect you from having a severe disease, which means death, hospitalization, or ventilator. As I said, if you got, for example, God forbid, hopefully you'd never get COVID, but if you do get it, if you just have drainage and sinuses and a little bit of headache and the body aches, that's acceptable to all of us. But what's not acceptable is getting hospitalized and dying from it, or having prolonged COVID and side effects and scarring of the lung. So remember, all of these are effective against hospitalization. As far as getting the infection where you may have some symptoms, you got Moderna as 94%, you got Pfizer 95%, and J&J as 66%. All of these are effective after 14 days after the 2 doses of Moderna and Pfizer and 1 dose of J&J, because your body needs about 14 days to make those antibodies. So once you get the vaccination, from next day, you're not, you can't just leave your mask out and say, oh, I'm ready to go out because I got the vaccine. So you got to give yourself 2 weeks. Looking at the allergic reactions, Moderna has not had significant allergic reactions except for patients that have shellfish allergy. Pfizer had a couple of anaphylaxis reactions. So if you have severe allergies, just be careful, keep an EpiPen with you. With J&J, we have all heard about blood clots, but if you look at the numbers, 16 people out of about 8 million vaccinated got those clots. And plus, of course, all the other side effects of the regular vaccine that we have with Moderna and Pfizer. So if you have had blood clots, then you should not be getting J&J. Again, we'll have infectious disease specialists talking about it in a little bit. Okay, so I just wanted to present this slide quickly. We have a lot of misinformation in the community. Number one I hear is there are trackers that are being inserted into the arm so Bill Gates can monitor you. Well, that's totally wrong. There are no trackers that can be inserted in a liquid that the R cells have drawn and injected from the muscles. Any one of us that have given a vaccine in our offices, we know that there is no such thing. The second one I hear is, I'm so young and healthy, I'm not at risk of dying and getting severely ill, so I don't need the vaccine. Again, very wrong, especially now that we got the variant. We have more and more younger people getting sick, even children getting sick. So another reason to get vaccinated is this is not true for the variant, that if you're old and sick, that's the only reason you're going to end up in the hospital. So in fact, we just lost a 31-year-old in a hospital that I work at, no previous medical history at all. So also the other one I hear is no one knows the long-term side effects of the vaccine. So now again, just like I showed you, there are over 2.4 billion people vaccinated. Within a year, about a year, if you count the studies when they started to the point that we got the EUA, the vaccine are none. But if you look at the COVID infection and the long haulers, you got significant data that if people get the COVID infection, that they have more long-term morbidity, they can't go to work for a long time, they have lung diseases, they have a lot of other issues as compared to the vaccine. So get vaccinated instead of getting the virus and getting the long-term problems from the virus. Now, COVID vaccine will give me an infection. That's another one I've heard. So if you look at the previous slides that we talked about, that this is dead viral, mRNA, or the DNA. So the virus is dead. All we're taking is the genetic material of the virus, so our body can recognize it and make antibodies against it. And remember, that's another one of those things they say, well, it's going to alter your DNA. Well, if you get the virus, you're going to have the same thing. You're going to just have a lot more DNA and RNA to deal with, where your body will not be able to handle it, and God forbid can end up with a lot more complications. So anytime we get a viral infection or bacterial infection, that's what we're getting. We're getting that live infections, DNA and RNA, making our body make antibodies against it. So it doesn't alter our DNA. And so that's another one of the misinformation that's out there. So get vaccinated. Don't listen to people that have no scientific basis behind their claims. Now, again, this is, I think I already covered. If you get the vaccination, you still have to continue precautions, especially with the variant out there. And currently, we are seeing a peak. So continue to be very cautious, and at least give weeks after the last dose, 2 doses of Moderna and Pfizer, and then J&J vaccine. You need 2 weeks to have enough immune response to protect yourself. Continue hand washing, continue face mask, keep a 6 feet distance, and outdoors better than indoors if you have to meet. So that's the end of my presentation. We have Dr. Javed Akram, that's a renowned infectious disease specialist at THR Presby Denton. We also have Dr. Sabina Amin. She's a well-known internal medicine physician in the community, and we'll hear their thoughts, and we welcome any questions that you may have. Thank you. Dr. Akram, any thoughts on any of these slides? Any word of wisdom from you? We also have Dr. Sabina. I think you're muted.
Can you hear me? Yes, now we can. Okay. Basically, since the COVID started, initially we had all kind of all ages of the people came to the hospital, old, young, but mainly was the old ones. And now after we had a vaccination and
we can't hear Dr. Akram.
Well, some of us do. I can hear them.
Yeah, I can.
So not everybody. Not everybody.
Okay. I don't know if I have to do something here or. Can you hear me? It's a smaller hospital, so it's easier to keep a tab how many patients we have and what is the mortality. But I would say 3 weeks ago we had about total 10 patients, 4 in the ICU. All 4 were unvaccinated, middle age and old age. The rest of them were on the floor, stable, mild symptom. After 2 weeks, last week, one of our hospitals was on call, and then I was on call, and the total number of COVID was 47. And I'm just talking about a small hospital in the West Fort Worth. So, I mean, that speaks for itself. The Delta variant, again, like you said, it's not a hoax. Things are happening, and it's trying to find the host who has not been vaccinated. So I did call a lab to see if they're checking specifically for the Delta variant. They are not, but they're just doing the NAT, the COVID-19 NAT PCR. So this was my input from my hospital and what we are seeing. And obviously, we'll never find out which of our staff members are not vaccinated. I mean, we are still following the precautions. Let me tell you that we have PPEs, but we had a little bit of guard down cautions in the end of May, beginning of June, because we didn't have that many things at a station, and it was not kind of a mandatory. So I hardly see anybody wearing a face shield now, though. But still, we're doing our N95 mask, and some people use goggles, some don't. I do use goggles, and so this was my input, and also I can shed some light during my travel. I took the opportunity when the COVID was down, beginning of June, to travel to Pakistan because my niece and I've got few friends who are physicians and cousins who are physicians. They told me that COVID number is markedly down. They work in hospitals. So I went there, and I went there 14th of June, around 14th, 15th of June. Hospitals were almost none. The COVID hospitals were, you would say, very, in the Holy Family Hospital, I don't know how much of you are aware of it. It's in Rawalpindi, and Holy Family are where we did clinical rotations. I believe Dr. Akram went to Rawalpindi Medical College as well. It's a fairly decent sized hospital. In the whole hospital, there were 20 patients. And the reason I went there was AMWPA had given some PPE masks, which are not available for the physicians there at the moment, N95s. It was, they were buying it at 600 rupees a long time back, and gradually the prices climbed to 2,400 per mask, 2,400 rupees. But not everybody had access. So I did take the, thanks to Dr. Kausar, AMWPA, that I did take the donation and gave it to them. And it was highly appreciated. And while I was there, nothing, within 2 weeks, I was there for a total 2 weeks, about 12 days, I would say. While I was there, I started telling the numbers were going up. I spoke to them, and now it has peaked, really, right. The various hospitals.
So Dr. Akram, would you say that currently to continue the masks for vaccinated and unvaccinated? And I think we have a question on the chat as well.
Yes. Can everybody hear me now?
Yes.
Okay. So what I was going to say is that in the beginning of the pandemic, we had all kind of ages, mainly the elderly people, but later on, now, since all the elderly are vaccinated, majority of those, some still are coming to the hospital which are not vaccinated. So right now, for the last month and a half, I have seen majority of the people, I would say more than 90%, they are less than 50 years old. Mainly are 30s and 40s, and they are the parents of the teenagers. And majority of the time I hear from them, oh, my daughter went to, or my son went to a camp and they came and we got sick. And the parents are in the hospital and they are in pretty bad shape and they are not vaccinated. They are not vaccinated. That's the main thing, is that we have two patients who were vaccinated with Pfizer, and one I've been following, and she's 74-year-old, went to visit her son in San Antonio, and son was sick, and I think she didn't know and we didn't know what was the reason, and she was in the same house, and she came back, and second day she ended up in the hospital, and next day son's called that, oh, he's in the hospital with the COVID, and he was unvaccinated. So, like, I mean, you said that vaccine is not 100%. You still have to take care of yourself, and the transmission depends on the type of exposure, the duration of the exposure. If you're in the same apartment with somebody who's unvaccinated, and you're breathing in the same small room or same apartment and coughing and all those kind of things, so your risk is still high with the age, with the other underlying conditions. So it's better. I mean, most of the time, what I've been seeing right now is that the grandma, grandpa, they are vaccinated, but the rest of the whole family is not vaccinated. So they're all risk for each other and for the people who are vaccinated.
So we have two questions, Dr. Akram. One is somebody's mentioning a study that's saying earlier you're vaccinated, more likely that you can get COVID again. I'm not sure what study they're mentioning.
Yeah,
one more question is, are symptoms of Delta variant different than others?
well, I'm not sure about the study so far. Thank God, I think I was the first or second day we got the vaccine in December, and alhamdulillah, we are okay so far. And I mean, main thing is that even though you're vaccinated, doesn't matter. It's a early part, later part, you still have to take precautions. And I'm sure everybody heard that Pfizer is saying that we need a booster, but the CDC and FDA say no, not right now. So I don't know. Hopefully, we have to see more studies or more information about the booster, that how long the initial vaccination is going to last, 6 months or 8 months or 1 year, and when we're going to need the booster. That's still debatable. As what was the second question, sorry?
Are the symptoms of the Delta variant different than others?
Yeah, I mean, that thing, I called the health department, local health department here, and I asked them that who is testing for these variants, and I was told that the state is the only one which is testing. And so we are seeing the patients with the same symptoms. I mean, initially, obviously, the very beginning of the pandemic, everybody was saying that, oh, you have a cough, fever, short of breath. But now you see every kind of symptom, starting from GI symptoms to pulmonary embolism, clots in the lungs, clots in the legs, and fingers, ischemic changes, stroke-like things, seizure-like activities. All those kinds of things are there. So from clinical standpoint, it's very difficult to tell that is it Delta or it's a wild type, unless you test that particular, and the state is not going to do every specimen test. And I was looking some of the results from the CDC website that in the Texas state, they tested less than 2,500, and the 42% were Delta variant. So there's a pretty good number, and the chances, the indirect evidence is that all those people who are coming right now, they are unvaccinated. So they were unvaccinated a year ago or 6 months ago, they were not sick, but now they're getting sick. So that kind of makes me think that do they have a different variant that they're getting sick now? So, I mean, I really, I don't see any difference in presentation starting from the beginning of the pandemic.
But I do agree with you that I think we have seen more like even some people coming in with hearing issues or sinus congestion more than others. So yeah, I do agree that at this point, any symptom, if we have symptoms of viral infection, you really need to kind of get tested. Of course, we have seen RSV more lately too. But yeah, I mean, at this point, if you have viral infection symptoms, just get tested. And the most important thing is get vaccinated. Like go tomorrow. That's how important it is right now.
I'm sorry. I wanted to mention that our hospital that time tell 87% of the people who are not vaccinated.
Correct.
Who got the COVID. And I was posed another question about people who have received J&J, knowing that its efficacy is not as much as Pfizer and Moderna, can they receive a dose of Pfizer vaccine? So I did try to search on my own, which I did see that you can. But what are your thoughts about it? Adding to.
Well, I mean, that's the same question a lot of people ask me. Oh, I took Moderna, can I take Pfizer also? I mean, I don't know that if there's going to be any reaction or side effect, but it may add. I don't know. I don't think there's any studies done to see that if you have one vaccine, can you go to the other vaccine? I really don't know the answer, but some of the people, I think, in overseas, they had like one vaccine, then they got the second vaccine.
That is true.
Yeah. I want to be more safer. So that's what their answer is.
So now for the J&J, initially when the vaccines came out, the CDC was very clear that even if it says, with the J&J that your effectiveness is 66%, all of the vaccines that are out there, they are very effective against severe illness, which is hospitalization, death, intubation. So the 66% that we're seeing is really, I mean, they may still get the mild disease, but not a severe disease, that is really not acceptable. So I don't think from CDC standpoint or from effectiveness standpoint, you have to worry about J&J and then giving them another vaccine again. Again, we don't know how they're going to respond to it. So at this point, just get vaccinated is the most important thing. Whatever you can get, if you have Moderna available, Pfizer available, of course, we'll prefer that. However, it's not something you need to, that should not be a limiting factor, that I just want J&J or I just want Moderna. So I think that's how I would take it. Now, we have more questions, Dr. Akram. One is, number one, Muslim community. What percentage of Muslims are vaccinated in our community? And then the other couple of questions are, one on the antibody tests. What should we look for? What's a good number? If we do antibody testing, which I think you can comment more. And the other question is the PCR positivity for Delta variants. There are rumors that PCR are not positive in Delta variants and that they should get what test to be sure they have COVID. It's PCR, basically it's PCR as accurate for COVID variants as it is for the previous variants that we had. Delta.
So as for the testing, I think, like I said, that I don't know that if the local labs are capable of testing it. So only the state lab, which is doing the testing, and whatever testing they have, they do the random testing. They don't check every specimen. And like I said, that so far they tested below 2,500 samples in Texas, and 42% of those are Delta variant. So that's kind of like how they randomly collect the samples. So it's a pretty big number of Delta variant, like about 42%. So I think the main thing is that, like you said, that vaccination and hand washing and face masking still is very, very important, even though you are vaccinated, especially if you are around people who you are not sure, even your family members, you're not sure that if they are vaccinated or not. So it's better to be safe, because once you are sick, and I have seen people, young people, 23-year-old, I have seen just made around today, and he's on airway and all that. He has no medical history at all. So no vaping, nothing. So I don't know that how people are going to react once they get sick, and that's more trouble than putting a simple mask on the face. I know sometimes it's very difficult and it's hard to breathe when you're sitting somewhere where a lot of people are, but I think that's still safer than going to the hospital and ending up intubation and all those, and your family suffering at home. So I think the best thing is, number one, vaccination, number two, precaution, even though you're vaccinated.
Now, for the antibody testing, as for right at this point, I know CDC is not recommending it.
No.
So what about the immunocompromised individuals that are on lupus or something, and they don't know if they have an antibody response?
Yeah, that's a very common question, that which kind of antibody testing I have to do, and what is the safe level? And the same question, I think Dr. Fauci and other experts, they have a similar question. There's no real cutoff number that, okay, beyond this, you're going to be safe. So again, there's a friend of mine who got COVID about a year ago, in last July, and he always comes to me, hey, I still have an antibody in my system. So are they really protective, or they just the antibody sitting there in the body, or they have low-level antibody? So I really don't know that what is the safe level in your body, which you can say that now I'm protected.
Mm-hmm.
So even though you have antibodies, again, it may not be 100%. It may be still you have a risk where you can still, again, like I said, that the type of exposure, the duration of exposure, and what kind of protective measures you have. So even if you're vaccinated and you're in the hospital and you're close to a patient who's just extubated or intubated and a lot of exposure. So still there's a risk if you don't have a proper masking and face shield and all that. So those kind of things do happen. But I mean, I can say that I have antibodies, but are they protective 100%? I don't know.
So now
This-
currently,
Sorry. Another question that has been asked is that people like you had mentioned one of your patients who already had the vaccine and then she contracted the infection from her son.
Sure.
So there is a case, one of the orthopedic surgeon from Pakistan who received Sinopharm. That is after he initially got one COVID with and treated with remdesivir and all whatnot, steroids and everything. Got recovered. 2 months later, had another bout infection that was milder, and by that time, one vaccine was received, and then he received the second vaccine later, and 3 months later, 4 months later, DVT bilateral PE.
That's exactly what's going on now.
But is it possible he had his antibodies titers checked and there were 0 antibodies? So are you seeing any cases who do not develop any antibodies or the antibodies get washed away?
yeah.
It's a very interesting question, but I don't know if we know the answer right now. So, I mean, I think there was like a few months back in England, they had some study done or some kind of data where they say that the people who had COVID, their antibodies were present even up to 6 months. So now probably maybe longer than that. I'm not sure. But again, the question is that are those antibodies are protected?
Mm-hmm.
So that reminds me that hepatitis B vaccine, sometimes, in certain, especially the dialysis patients, where they may not develop antibodies. So you can give 2 times vaccination series and then that's it. You don't check their antibodies. That's what the recommendation is. So I'm not sure that if we are going into the same kind of situation here, that you get the vaccine and then you just still use the protective measures, and whether the antibody levels or the antibody presence is going to make you more protective, I'm not sure.
I think this case that you mentioned actually points to 2 most important things that we're saying. One, if you have had COVID disease, that does not confer immunity. And that's what we keep saying, vaccinate regardless if you had COVID infection or not. Number 2, even if you got the COVID shot, that does not mean you're 100% protected. You can still get it. So this person probably had just bad luck. He did not have immunity post-disease, and then he gets vaccine and he does not develop antibodies. One of those 1 out of 20 that we see that don't confer, get antibodies.
Sure.
What percentage of Texans are currently vaccinated, Dr. Akram?
I think the number is around 40%, I believe. So we're still way below.
So what do you think in Muslim community? Do you think that number we can improve, or is that exactly the same as general Texan population? Or
I don't know if there is any data about the Muslims especially, but I think we in our mosque we always preach the same thing, that please get vaccination. And I think the majority of the people, they got it, but there are certain, I heard from one of my friends that there are certain, I think, sheikh or somebody who's saying that, this vaccine is not good for the Muslim. They have, like you said in the beginning, that they may have some tracker or something bad, which is not good for the Muslim. So those kind of rumors are there out in the social media or somewhere where that's kind of like putting Muslims or in general the other people at risk for dying from COVID.
correct.
So I would say that, your kids get vaccine from for the other diseases. Why not this one?
Absolutely. Yeah. So you would say vaccine is safe in teens at this point, correct?
Yeah, there's no doubt about that because, I think majority of the healthcare workers, they got it in December, and we are here in end of July. So I think, alhamdulillah, we are all alive and we are okay. So it's safe.
What about, well, how do you convince people that are still skeptical on getting vaccination? After, even though we have put all these slides up, we all see patients, family members. There's nothing we can do to convince them. What do we tell them?
Well, I mean, as a physician or as a medical provider, I mean, we all have seen the patients in the hospital who are not vaccinated, and majority of those are young, like below 50, 45, 30, even 23. As I said, that's the youngest I have seen today. So, we can just tell them that it is not fake, it's not hoax, it's real, and the vaccination works. And that kind of like a proof that now you don't see those elderly people in the hospital because they are the first one who got vaccination. So they are safe, majority of those, and they are at home. And the young people, relatively younger people, their kids, their children, those did not get vaccine, they are suffering now. And I mean, if you get sick, the whole family going to suffer. It's not only you going to suffer. If you are the one who's breadwinner, what about your rest of the family? If for God's sake you died, and then what are you going to do about your kids or your wife or your other, or if it's a female, the same way. So I think I don't know, it's like last week or week before, I got a text message from an orthopedic surgeon who is a white surgeon, and he was arguing with me that, oh, why do I need 2 shots? One is good enough. All the studies are saying one is good enough. So in certain situations, you cannot convince them no matter what you do, but you can tell them that it is safe. I had it and I'm fine right now. I didn't have any tracker in my body. I didn't have anything, and it is safe and it's protective. And you can see now the new evidence that all the young people who are not vaccinated, they are in the hospital. Like 90% of those are unvaccinated.
So we have a lot of questions, Dr. Akram. So we're going to try to go through them quickly. One question is, what about kids under age 12? The schools are opening. What is the risk?
Well, I mean, like I said, that I had like 4 or 5 patients. Their kids, exactly 14-year-old. That's what they mentioned. 14-year-old, 14-year-old, 14-year-old. So they went to a camp. They came back. I'm sure they got it from there, and they gave it to the mom and dad. So the kids were luckily okay, but so they may not have it, but they can bring it home to the grandma, grandpa, parents. So that's the risk there.
So what, do you know when is the timeline going to be to get it approved over 6 months? I heard something about September, but.
So, yeah, I mean, right now they're trying their best to bring it as quickly as possible, but I'm not sure that if they are in phase 3 or not.
So now the masjids that are open, should we enforce vaccination cards and 6 feet distancing in those locations? Is that something should be recommended at this point?
I can tell you what we are doing in our mosque. I mean, we were very, very strict, and for the last month or so, we are not checking the temperature, but face mask and your own prayer rug and the social distancing. They have marks on the carpet, so numbers, so you stay 6 feet away from each other. And that's going to continue. And now, especially when the numbers are going up, it's not going to go away. And temperature checking and symptom screening, that has gone. Most of the hospitals are not even doing it right now.
What about vaccination cards?
I mean, that's there's going to be so many excuses that, oh, I forgot at home or I don't have it. And also, I don't think you can enforce people to bring the cards. I mean, in this country, I don't think it's going to work. Mm-hmm. But you can trust what they tell you, but you cannot ask them to bring the card.
Right. Now, I think there are a few other questions. How do you answer those who say There are many examples of patients getting infected within a few days of the vaccinations. And I think there are a couple of them is once they do get sick, what are their treatment options?
We treat, once they get infection, we treat them just like anybody else. Like now, this remdesivir is the main treatment we use along with steroids and some azithromycin, antibiotics and all that. So if they're sick, we treat them no matter if they have a vaccine or they don't have a vaccine. So the treatment is same and pretty aggressive for all those regards.
But what would you tell them about the Regeneron antibodies? Like what is the, should community know about that? Like when they get sick, if they're high risk, where do they go for the antibody infusions?
Yeah, those are still the outpatient, and they're not, I think, approved yet for the hospital isolation. So they are like a mild type, like if you got tested and you started having symptoms. So the best person is, some people, they just call the ER doctor or go there, and the ER doctor has seen that they refer them. There are only like, I think, few clinics here in North Texas area which provide that. So their PCP is the best source, and then their PCP can find out that where those clinics are. But even the ER doctors, they know where they are, and they can tell the PCP that, okay, these are the, I think it's a little process that you have to fill out the forms and all that, and then they schedule you to go there and get the, and that, it will work. It will work, because I personally know some people who got it and it works.
So is this the same one that President Trump got?
Kind of similar, yeah, yes, yeah, there.
So, okay.
Now there are like 3, 4 available, so yes, they are kind of similar.
And in the Arlington area, there are certain ID doctors who are aware of the urgent cares who are offering these Regenerons. Because talking of another physician who travels frequently to Pakistan, he's got an urgent care here.
Oh.
He had COVID second time after he negative from Pakistan, positive here. And that was his second episode. He went straight away for the IV antibody infusion. In fact, the hospitals are not offering it. They're only giving medicine plasma, but none of our hospitals have given any infusions.
Correct.
Right. So Regeneron is more outpatient. Like when you go, if they have a mild disease and if they have underlying hypertension, diabetes, or overweight, they just need to call the ER and say, hey, I need antibody infusion. I'm COVID positive. You just go in, get the infusion, go home. And so it's not, as Dr. Akram said, not for inpatient at this point. I think that those are all our questions. There's one more question I just saw. Once diagnosed with symptoms with positive PCR, what should they do for treatment? I think this means outpatient treatment.
Yeah, I mean, some people, they suppose they are in the party and they kind of like are afraid that they got some from somewhere and they go next day to be tested. The test is positive. But that doesn't mean that they have a disease. So if they have a symptoms, then they need a treatment. So if they are asymptomatic, they can watch and see that how things are. If they don't have any kind of symptom, like we all said, that now it may not be short of breath, it may be diarrhea or maybe a headache or maybe something like that. So if they see the symptom, then go ahead and get that antibody for the outpatient. But if you get sick, too sick, then obviously you're going to go to the ER and get the rest of the treatment like other people get it.
And how long should they isolate outpatients that get mild disease? How long should they be isolated?
The CDC is saying is that 7 to 10 days is good enough. After you have tested positive and you are asymptomatic, 7 to 10 days, even you can go back to work. That's what the CDC website says.
Now, there's a question about getting acne, skin conditions from wearing masks. What should they do?
Just like I said, that little bit trouble is better than going into the hospital and getting all those kind of oxygens and therapies and ventilators. And So that's a lot more. So you have to see that what you want. If a little bit mask, I mean, obviously you don't need a mask all the time unless you are in the hospital, like the healthcare providers. So we are, I mean, we have to put those masks on. But if you're outside somewhere, you don't have to put a mask all the time. I mean, if you're alone outside in the park sitting there, you don't need a mask. Or if you're in your car, you don't need a mask. I mean, if you're alone. So you can see that where you need a mask. And I don't think it's going to be a big trouble. So you have to compare that what trouble you want.
One question is, with someone working in a clinical setting, like a physician, what extra precautions can they do? They have gotten a vaccine, they wear a mask, they stay socially distanced. Is there anything else? Is there any supplements they can take? Is there anything else they could do to protect themselves?
I mean, in the beginning, very beginning, I think there was like a lot of, they were saying that zinc and vitamin C and all those. So basically, I mean, those are the common things which you can still take it and keep yourself healthy. And that will help you to protect you from those things. But as such, I don't know if there is anything available to say that, okay, I have to take this thing to protect myself. The best thing is the type of mask. If you suspect somebody, your patient is coughing, or, I mean, most of the time, my nurse, they always screen that, do you have a fever? Before they even come to the clinic, we check them beforehand, all the symptomology. And even if sometimes they don't tell you the right thing, then they come and they're sitting in the waiting room and coughing. So when you have to see them, then you better put your N95, face shield, and protect yourself.
So one more question is, if let's say that everybody's vaccinated, for sure, you get the vaccination cards, can they mingle?
Yes, that's the situation where the CDC say that small gathering. I mean, I don't know if they gave the number, but I think 50, 40, whatever. And if you're sure that they're all vaccinated.
Right. So I think another important point in this program is, at this point, unvaccinated individuals are a risk to the vaccinated individuals. That is where the virus is going to mutate. We are going to have different strains. So at this point, every one of us and the family members, kids 12 and older, everyone should do everything to get vaccinated if you don't want a death in your family, a hospitalization, and prolonged COVID. So be safe, get vaccinated, get an appointment tomorrow, and watch this program again if you have any more questions.
And just a message for general internists and hospitalists, if they're running on the Zoom today, that what we do mainly is try to find the source, like ask more questions. I know we are in such a hurry, we've got so many patients to see. Where did they go? Where did they interact? And at least we do tell them that immediate family members who they live with, children who they visit, they should get vaccinated. I mean, that's all that we can do so far. So we do, and just one more point I wanted to make. Our beginning of discussion was when they checked for the COVID, they only checked for the COVID-19. Certain urgent cares are doing. When I was traveling for Pakistan, they did COVID testing, and it not just tested for COVID, it tested for 14 other variants of viruses as well. It's like we say sometimes we're not sure what the symptom is from. Any viral illness can present it.
I think you're talking about the respiratory viral panel. Yeah,
that's what I'm talking about. So that's pretty good, pretty neat.
So, I have had actually a couple of patients that showed up to the ER, even hospital. We asked for it. And some of the ER physicians are now willing to do it because they'll say, oh, it costs $1,500 to do that test. So I don't know what Dr. Akram thinks about it.
Most of the time we do those kind of PCR patients who are hospitalized in ICU when you're not sure that what they have at that point. I think not commonly, it's not a very common test, because in that you will see that coronavirus showed up and then everybody, oh, this patient has a COVID. no, this is not a COVID, it's a different type of corona. So that's why it's not kind of like commonly recommended test, but sometimes we do that. Just last, I mean, I remember now that you were asking me that how to convince those people. I mean, over the year and a half, I have seen the post-COVID complications. Like, I have seen like a 30-year-old who has a severe cardiomyopathy and end up on heart transplant list. I have seen a 30-year-old female who had a ischemic change in her foot and end up DKA. And I'm sure everybody now familiar with pulmonary fibrosis, that the rest of the life you may end up on the oxygen. So those are the complications from the disease. So those, I mean, you don't want anybody to have those. So that's what, I mean, I kind of like I have a friend who is a physician, and he had a COVID from his patient in December, and now it's July. I happened to see him like outside, and he still said that I'm not 100% recovered. So those things are there, and all you have to look around yourself, your friends, neighbors, and who had a COVID and what they're doing, how they're suffering right now with the complications from that.
Very, very well said, I think, Dr. Akram. That's so true. You know, at this point, we need to believe in science, believe in our physicians, believe in, you know, CDC at this point. Just get vaccinated at this point. One last question I have: what about the pregnant women?
The vaccination or
vaccination and pregnancy for COVID-19.
In the study, I don't think they studied especially the groups, but I was reviewing that some of the women, they got pregnant while they were in the study. So they don't have enough data, but in fact, last week, or in fact, the patient still there, we are giving, she's pregnant, 27 weeks, and we have to give her treatment. So we are giving remdesivir. So remdesivir was not studied on pregnant, but during the study period, they had a few pregnant women. So on the basis of that, we are giving it. So I think, I'm not saying that they should get vaccine, but I don't know if there's enough data to.
I know whatever cases so far we have, that it's fairly safe. I've had a few physician females that actually did get vaccinated, and that baby had antibodies. So I know there's more and more data coming out, but yeah, at this point, it's still, as you said, if they get an infection, they're going to get an antibiotic. That's also we don't know if it's safe in pregnancy.
Correct.
We don't know what the long-term effects are of COVID disease on the fetus, but we have some data at this point. Again, it's not where CDC is recommending, but they're encouraging pregnant women to get vaccinated.
Correct.
Well, thank you, everybody. Thank you,
you.
Dr. Amin, Dr. Akram, everyone that's here.
Thank you, everyone. We appreciate it.
Thank you.
Thank you for the time. Thank you. Bye-bye.